Hey guys, Coach Chad, bottom squat position again. Okay, now today I want to talk about restrictions in the ankle, which a lot of us will have, myself included. And what I mean by that is when you get down this bottom position and you force that knee over top of your ankle, so you can find that by pushing. Some of you guys will be obvious right away, others you might have to find it. But when I push this one forward on my left side and try and drive the knee further over the toe, I just get a little deeper and deeper stretch in my soleus back here and into the base of my Achilles tendon. That's kind of what we want to see and what we're looking for. When I do that on my right side, I don't feel anything on the posterior aspect of my leg. All I feel is a lock or a pinching sensation on the front of my ankle. Now, most likely what that indicates is a bony structure, basically not really an impingement, but a blockage in the ankle here. And most likely it's going to be due to the talus bone. So you have your tibia and your fibula sitting here. Underneath that is your talus bone, which then sits above your calcaneus. And as you go into dorsiflexion, there's a few things that happen on the foot. So we'll kick this out of here for a second. But as you go into dorsiflexion, allowing the knee to move, the midfoot will actually slightly evert slightly. It's going to drop down, and the talus bone slides back. It should at least slide back, freeing room for you to gain some dorsiflexion. Now, in this case, it could be due to injuries, maybe past sprains, whatever it is, or just a structural position that you have in your infrastructure or the way your foot's made up, that this gets in the way. Now, there's a few things we can do. We can manually push the talus bone back a little bit and see if that helps. So it's just very difficult to do on yourself, but you can manually push it back, opening up some space so you can gain some room. Or the easiest way is to use a band, okay? So if you're getting that pinching sensation, you should pull a band out when we do the 5-minute squat. And you're going to want to put the band around your ankle, okay? Like such, okay? Now, if you think about your ankle position, you have the two malleoli here, the two bones. You're gonna want the band in front and below of that, okay? So it needs to pull down below here, so it's below the tibia, and it's pulling on the talus, and you're gonna pull back on that position and then sit into your squat and see if that improves it, okay? So I have a band attached over here. I'm just gonna scoot out of the video for a second. I have a band attached over here to a squat rack. This one's a little bit thicker. I'm going to put a lot of tension on it. And you can do this unilateral as well. So I could put a lot more tension on this if I wanted, but you can see that I want to place that as low as I can here, below my malleoli, have it pulling back, and then as I go into dorsiflexion, all of a sudden that pain that I had before is no longer there, okay? And I can get a little bit more range. So when you're sitting in the bottom of your squat, what you can do is just use a band on one or two of your ankles. So now when you're sitting down here, theoretically, I can get a better position, and I can do so without some of the rotation that I might have had earlier or the pain that I had in my ankle. So this is one quick little fix for a bony structural issue if you're having it in the bottom squat position, which could make major improvements in the comfort as well as the range of motion that you have in the bottom of your squat. Okay, thanks team.